Hi friends, welcome to the channel of Agatandra, that is toxicology. Today, let's discuss the topic general principles of treatment in case of poisoning. Coming to the first slide, the general treatment it is given if the specific nature of the poison is not known. The condition of the patient can be assessed by detailed clinical examination based on the degree of loss of consciousness and presence or absence of other medical complications. And first of all, the patient should be removed from the source of exposure. That is, if we do not know which poison that patient is taken, we want to follow the general guidelines in case of poisoning. And if we know the specific nature, we can do the treatment according to that. That is, which type of poison that person has intaken. So, first of all, we have to assess that person, whether he is conscious or not. If he is unconscious, we have to grade that. Yeah, we have to look how much unconscious he is or in which stage of coma he is in. Degree of loss of consciousness, it is graded by Reid's classification, and the degree of coma, it can be assessed by Glasgow coma scale. First, let's look into the Reid's classification. In that, there are four grades. In that, first grade, it is the patient is drowsy but responding to verbal command. And the grade 2, the patient is unconscious but responding to stimuli. And in the grade 3, it is that the patient is unconscious but responding only to very painful stimuli. And in the grade 4, the patient is unconscious and not at all responding. These are the four classification based on the grade of consciousness. When we look into the grade 1, that patient is drowsy. That is, the patient is in a sleepy stage or he is in drowsy mode, but he is responding to verbal command. That is, if we ask something to that patient, he is responding to that who is ask him what is the name, where is he now. That all questions he can respond, then he comes under the grade 1. And the grade 2, the patient is unconscious but responding to stimuli. That is, if we touch him or tap him anywhere, he is responding to that. Then he comes under the grade 2 classification. And grade 3 is that he is unconscious but responding only to very painful stimuli. That is, if we pinch him, we have to pinch in the nail bud, yeah, in the trapezius muscle or in the supraorbital notch. If we apply the pressure, that patient is responding. That we have to take care that painful stimuli, it is not that much stimuli that we should hurt that patient and we should cause any injury to that patient. It would be like that it should cause pain to that patient, but it do not cause any injury. And in that condition, if that patient is responding, he can grade into the grade 3 classification. In the last grade 4, he is totally unconscious and not at all responding to any type of stimuli. That is the Reid's classification of grade of consciousness. Next, we can look into the Glasgow coma scale. That is, patient is unconscious and we have to look how much he is in comatose stage. That it is grading is like that. In the case of mild, the points will be 13 to 15, and for moderate, it will be 9 to 12, and for severe, it will be 3 to 8. And in that, we are mainly looking three types of response. That is eye-opening response, verbal response, and motor response. In the first, that eye response, there are four grades. That is spontaneous, 4 to sound, 3 to pressure, 2, and there is no response at all. It is 1. That is we are looking whether his nervous system is functioning properly. For that, we are looking into the eye response. That's first one is spontaneous. That person is opening his eyes in between without any stimuli. That is, he is sometimes opening his eyes and looking at his surroundings. Then it comes under the spontaneous group. That is under grade 4. That to sound. That is, if we make any sound, yeah, if we call that patient or make any sound, that person is opening his eyes, then he is coming under the grade 3. Then to pressure, like we have discussed in the consciousness, that if we give pressure to any points, that person is opening his eyes, then he comes under the grade 2, and there is no response at all to any stimuli. There is no eye response at all to any type of stimuli. It comes under the none group. That is, he is only having 1 point for that. Then next we are looking into the verbal comments. That is whether he is responding verbally. He is able to speak something. Then that also we are checking his nervous system. In that, there are 5 grades. First is orientation. If he is oriented, then it comes under grade 5. But if he's in confused state, it comes under 4 grade. And if only words are there, there is 3 point. And for the only sounds he is making, then it is 2. And at no response at all, it comes under none. In that first one is oriented. Orientated means that patient is well knowing that where he at where is he now? What is his condition now? What is his name and surroundings? What is the date and time? If you're asking that patient, he is able to tell that, then we can say that the patient is in oriented state. Then it is in confused state. We are asking something, answering, but he's in confused state. That is not that much oriented. Then he is coming under the grade 4. Then if you're asking any questions, not only words are coming. That is that words, there it is also some irrelevant words are coming. What we are asking and what he is responding, it is very irrelevant, and only the words are coming, then he is coming under the grade 3. Then in the next grade, in that he's making only some sounds. That is only sounds are coming, then he is coming under the grade 2, and there is no response at all. It is coming under the none group. That is only 1 point are there. Then in the last of that, it is a motor response. In that first one, that is he is obeying commands. That is, if you're asking him to lift his hands, yeah, move this side, he's obeying that. Then he comes under the grade 6. Then he's localizing. That is, if we are giving any painful stimuli, he's localizing that area. That is, he's trying to move away that area. Then he's coming under the grade 5. Then next grading is normal flexion. That is giving some stimuli, he's doing the normal flexion. That is adduction and the flexion of the elbow joint. It comes under the grade 4. Then there is in the grade 3, it is abnormal flexion. That is that flexion, it is not normal. He's adducting his arms, but his elbows are extended. Abnormal flexion. Then next is the grade 2, that is extension. That is that the extension, it is abnormal, then it comes under the grade 2, and there is none response, it comes under grade 4. And by calculating these points, we can assess that the Glasgow coma scale, that is he is in that whether he is in severe comatose state, in the moderate comatose state, yeah, in the mild comatose state. And according to that, we have to check the response. Nowadays, the pupil response are also included in this Glasgow coma scale. That is based on the reaction to the light of the pupil. It is also included in this Glasgow coma scale. In this way, we can assess the condition of the patient. Then the general measures we can discuss in the next class. Thank you.